This is the recording for Occupational English Test, and the test is held at Medcity International Academy, Kannur on 17th April 2025. The candidate's name is Avinash and the candidate number is 63421.
Yes, ma'am.
The interlocutor is Roshni and the interlocutor number is 85192.
Okay.
This is role play number 1 for the profession of nursing. Good afternoon, Avinash.
Good afternoon, ma'am.
Can I see your identification, please?
Yeah, sure, ma'am.
Okay, here you go. This is a test of your English language and not an assessment of your professional knowledge. Keeping that in mind, speak as you would naturally.
Okay, ma'am.
We will first start up with a warm-up session.
Okay.
This is not in any way assessed.
Okay, ma'am.
Okay, Avinash, can you just give me a brief introduction about yourself?
First of all, good afternoon, ma'am.
Okay.
Thank you for giving me such an opportunity to introduce myself. My name is Avinash. Basically, I am from Andhra Pradesh, but currently I am staying in Kannur. I did my graduation in Andhra itself only, from the daughter entire health universities.
Okay.
Basically, I am from nuclear family, and my strengths are like I am self-motivated, very disciplined and talented person. And my short-term goal is to achieve a good position where I can build career and organization too. And my hobbies are watching movies and listening to the music. That's all about me, ma'am.
Okay, fine, great. Now, why did you choose nursing?
Ma'am, I chose nursing because of several reasons. First of all, it was my childhood dream to become a nurse. Besides, most of my family members are from medical field. Actually, their stories inspired me a lot.
Okay.
Moreover, nursing is a profession with a lot of opportunities in both abroad and home country.
Okay.
And what I want to say is, nursing is a profession which I can serve humanity. Hence, I chose nursing as my profession.
Okay, fine, great. Now, let's move on to the role play now.
Okay.
I'll be taking the part of the patient and you take the professional role.
Okay.
The role play will last a total of 5 minutes and you'll be given 3 minutes to prepare for the same.
Okay.
The role play intends to give evidence of your ability to perform effective communication with patients.
Okay.
Do you have any questions?
No, ma'am.
Okay, fine. So you'll have 3 minutes to prepare on the role play card. This is your role play card.
Okay, ma'am.
Here's your pencil and you can make notes on the role play card if you wish to do so.
Okay.
And you can look at the card during the test but must return it to me at the end of the speaking.
Sure.
Okay. So your 3 minutes of preparation time starts now.
Okay.
Okay, Avinash, that marks the end of your preparation time. Now we shall move on to the role play. Your 5 minutes time for the role play starts now.
Hello, Maria.
Hi.
Thank you for letting me to examine you. Actually, before proceeding further, it is just an inflamed ear piercing. It would be helpful if you explain it in more detail.
Okay, sure.
Could you please explain it to me?
What exactly would you like to know?
Like the onset, when it was started, and do you find any symptoms like?
Okay, it started, I noticed redness and soreness 2 days ago.
Okay.
And then I kind of felt a little discharge from that area.
Okay.
But there wasn't any bleeding as such.
Okay.
Yeah.
Thank you for answering my questions, Maria.
Okay.
Now let me confirm that. Have you followed any instruction during the time of ear piercing?
Actually, they've asked me to use this antiseptic liquid once daily.
Okay.
So I've done that and I've applied that with the cotton wool.
Okay.
But they also told me not to turn that earring. But
Okay.
you know, sometimes like I forget to do that and I used to turn the earring.
Okay, Maria, I totally understand that. Now, let me ask few more questions to understand your situation much better. Are you okay with that?
Yeah, definitely. You can ask.
Maria. Now I will ask. Now I'm going to ask. Have you noticed any issues with the past piercings?
No, I've never had any problems when I've had ear piercings before.
Okay. And do you found any allergies to the metals or chemicals?
No, nothing. As far as I know, I don't have any allergy.
Okay, Maria. It's quite good to hear that you are not allergic to anyone. Based on my findings regarding your condition, I found that the condition what you are having is a mild localized infection. Okay. And it is not a major concern. And the positive concern here, and the positive aspect here is it can be very quickly resolved. Did you get my point, Maria?
Yes, I understand.
Okay, I'm happy for that. Now I would like to recommend you some of the self-care strategies that you need to follow in the home. Can I explain it to you, Maria?
Yes, definitely.
Okay. Firstly, wash the infected area 2 to 3 times a day by using the warm salty water. Okay. And secondly, wipe it out that wet area by using the fresh cotton wool. Did you get my point, Maria?
Yes, I understand.
And moreover, try to avoid the perfumed body wash shampoo. Are you following me?
Yes, I understand.
Okay, Maria. Do you have any further queries?
No, actually, I feel quite silly about myself because coming and asking you for advice, because I could have just used the antiseptic liquid more often rather than coming for this advice. Okay, I understood that. That's a valid query from your side. Actually, I respect your thoughtfulness, but it's my role to explain you to clear all the concerns and make you to feel better. Okay. Am I clear so far, Miss Maria? Yes. Do you have any further queries you need to know? Actually, I would like to know what causes infections in case of this ear piercing. I'm happy to hear that, Maria. Really, you are trying to know more about your health conscious. I will definitely explain it to you. Actually, mostly this allergic reaction occurs in the people who are with sensitive skin. Okay. Are you following me? Yes. Okay. Now, I would like to recommend you some of the preventive measures what you should have to follow in our home. Can I explain it to you, Maria? Yes, definitely. Okay. Firstly, you should have to maintain the proper good hygiene before and after touching the infected area. Okay. And also, try to leave the earring in place minimum up to 6 weeks. Okay. Am I clear so far, Maria? Yes. I understand. Thank you for responding to my questions. Now, I would like to recommend that if you found any symptoms like increasing pain or redness or anything like abnormal infection in around your ear, I would like to strongly recommend you to consult a doctor. Are we on the same page, Maria? Yes. Okay, thank you, Maria, for answering my questions. I hope I had cleared all your concerns. Yes. We will definitely sort it out together. Okay. Are you clear for that from everywhere? Yes, the advice was really helpful and I'll definitely follow it. Okay. Once again, I will summarize what I have been told to you from the starting onwards. As I said previously, it is a mild condition, which means you need not to worry that much. And the positive aspect in this is... Okay, Avinash, that marks the end of your speaking test. Please return the role play card to me. Thank you. Okay. Now let's have a quick analysis of the performance of the candidate based on the speaking criteria. The OET speaking criteria is broadly classified into linguistic criteria and clinical communication criteria. When it comes to linguistic criteria, the first one is intelligibility. Intelligibility is nothing but pronunciation, the intonation, rhythm, stress. So what I feel is that in this area, the candidate was pretty much okay, but at certain instances, the influence of L1 accent was quite evident. Apart from that, it was fine. Then moving on to fluency, the candidate could speak at length without any hesitation or major pauses. So fluency was also fine. Then we have appropriateness of language. So appropriateness of language checks whether the candidate is able to simplify, if there are medical terms, whether the candidate is able to explain that in simple terms. But we did not come across any such terms in this role play card, so it was fine. The kind of words that were used, then the tone, register, the lexis, all were appropriate to the context. Then finally, resources of grammar and expression. I felt that this is one area which the candidate could have performed a bit better. That is, we could not see a wide range of usage of grammatical expressions or vocabulary, but the way he presented it was fine, but still there is scope for improvement when it comes to resources of grammar and expression. Now let's move on to the clinical communication criteria. Now in clinical communication criteria, the first one is relationship building. And I feel that the candidate throughout his speaking maintained a very respectful and polite tone. So relationship building was fine, and the greeting was also fine. The opening of the conversation was also fine. Then moving on to understanding and incorporating patient's perspective. Yes, that was also fine. The candidate tried to elicit ideas from the interlocutor or from the patient and then provided responses accordingly. Then regarding providing structure, the next assessment criterion, providing structure, there I felt that more of organizational techniques could have been used, like signposting. While moving from one idea to another, signposting could have been used. Apart from that, he followed the same structure as it is in the role play card. So the structure as such was fine, but more of organizational techniques could have been employed. Then we have information gathering, wherein the candidate performed well by starting with open-ended questions and then moving on to close-ended questions. And then he gathered all the relevant information. But here also one aspect, like after gathering the information, summarizing what he has received and repeating it back to the patient was missing. Apart from that, the information gathering was also fine. And finally, when it comes to information giving, he provided clear explanation of all the information that he had to give to the patient was given out clearly. And before giving out information, it is necessary that you need to seek the permission of the patient. So that was also seen throughout before giving out information. So overall, when it comes to clinical communication criteria, I would say that the candidate performed well. Now, as you all know, the linguistic criteria, each criterion is scored out of 6, and in total we have 4, so it's totally out of 24. And when it comes to clinical communication criteria, each criterion is scored out of 3, so in total 5. So we have total of 15 there, 24 linguistic and 15 clinical communication criterion. So it's totally scored out of 39. I'm not giving the score, I'm leaving it to you. If you need to score it or rate the speaking of the candidate, you may post it in the comment section. Thank you and stay tuned until we meet through the next video.
Medcity International Academy. Trusted hands forever.